Welcome to the ZeroDiabetes Zone. In today's video, we're going to debunk some of the most common myths about diabetes. There's a lot of misinformation out there, and it's time to set the record straight. Let's dive in. Myth number 1, diabetes is caused by eating too much sugar. Fact: while diet plays a role in diabetes, it's not as simple as sugar consumption. Type 1 diabetes is an autoimmune condition where the body attacks insulin-producing cells. Type 2 diabetes is influenced by a combination of genetic factors and lifestyle choices, including diet, physical activity, and weight. So, while eating a lot of sugary foods can contribute to obesity, which is a risk factor for type 2 diabetes, sugar itself is not the direct cause. Myth number 2, only overweight people get diabetes. Fact: while being overweight increases the risk of developing type 2 diabetes, it's not the only factor. Many people with type 2 diabetes have a normal weight, or are even underweight. Genetics, age, and ethnicity also play significant roles. Additionally, type 1 diabetes is not related to weight at all. Myth number 3, people with diabetes can't eat carbs. Fact: diabetes is a serious and chronic condition that requires careful management. If left untreated or poorly managed, it can lead to severe complications, including heart disease, kidney failure, blindness, and nerve damage. However, with proper management, people with diabetes can lead healthy, active lives. Myth number 4, diabetes is not a serious disease. Fact: diabetes is a serious and chronic condition that requires careful management. If left untreated or poorly managed, it can lead to severe complications, including heart disease, kidney failure, blindness, and nerve damage. However, with proper management, people with diabetes can lead healthy, active lives. Myth number 5, if you have diabetes, you'll know. Fact: many people with type 2 diabetes have no symptoms at all, or have symptoms that are easily overlooked. Regular screening is essential, especially if you have risk factors like being over 45, having a family history of diabetes, or being overweight. Early detection and management are crucial to prevent complications. Myth number 6, insulin is a sign of failure. Fact: insulin is a vital treatment for many people with diabetes. For type 1 diabetes, it's essential for survival. For type 2 diabetes, starting insulin can be necessary to maintain good blood sugar control and prevent complications. Using insulin is not a sign of failure but a step towards better health. Myth number 7, natural remedies can cure diabetes. Fact: while some natural remedies and lifestyle changes can help manage diabetes, there is no cure for diabetes. Treatments and management strategies, including medication, diet, and exercise, are essential to keep blood sugar levels in check. Always consult with a healthcare provider before trying any new treatment or remedy.